Hello, my name is Kathy, and today I'll be discussing how to use homeopathic remedies on ailments, continuing with hormones and metabolism ailments starting with the letter A. But before I do this, I wanted to let you know that because I have a great many videos now on many different topics, that I've decided to make several different video playlists so that it's easier to find the videos of greatest interest. So please check out my playlist page. Please refer to my How to Use Homeopathic Remedies video before using the material in this video. I'll be discussing how to use homeopathic remedies on specific ailments, but I've broken these ailments into categories for easier reference. I'll begin with ailments of the mind and emotions. Then I'll move on to ailments of the brain and nervous system. Then I'll address issues with your skin, nails, hair, eyes, ears, nose, teeth, gums, lungs, respiration, heart, blood circulation, muscles, bones, joints, esophagus, stomach, duodenum, small and large intestine, liver, gallbladder, pancreas, kidney, bladder. Then ailments specific to women and specific to men. Then issues of the hormones and the metabolism, and then homeopathic remedies for infections, infestations, and the immune system. Then issues surrounding fertility, pregnancy, childbirth, and postnatal problems. Then homeopathic remedies that address special problems in infants, ailments and diseases in childhood, and special issues of adolescence. And finally, special issues of the elderly. Constitutional treatment involves treating the totality of the individual person. Everyone is a unique individual with a unique physiology that responds to substances differently. In homeopathy, it's recognized that people will react strongly to certain remedies, and as a result of this, they can be loosely placed into different categories called constitutional types. Homeopaths talk of, for example, phosphoric types. These are people who react strongly to phosphorus, or arsenicum album types, those who react strongly to arsenicum album. The belief is that people of one type share similarities in terms of body shape, character, and personality, and the sorts of diseases from which they suffer. As an example, Natrum mirror people tend to be pear-shaped, have a dark complexion, be fastidious and rigid in personality, and keep themselves to themselves. They also crave salt and suffer from constipation. As another example, lycopodium types tend to be tall, gangly, and of a stooped appearance, with an anxious expression and a craving for sweets and a propensity to produce intestinal gas. Now, of course, constitutional types have their limitations. In reality, each person is an individual, and so there are as many constitutional types as there are human beings. An account must be taken of the sum total of the person's inherent predispositions, past illnesses, diet, general reactions to the environment, intellectual and emotional features, and general attitude towards life. This is what is meant by constitutional treatment. I'll be making detailed videos of the various constitutional types after I've completed the use of homeopathic remedies on ailments. The ideas, procedures, and suggestions in this video and all my homeopathic videos are not intended as a substitute for the medical advice of a trained health professional. Consult your physician before adopting the suggestions in this video. If you're pregnant, do not attempt these techniques without the approval of your physician. So, let us continue with learning how homeopathic treatments can help with hormone and metabolism ailments, starting with the letter A. Metabolism is the sum total of all the chemical processes that occur in the living body, and it is ultimately controlled by instructions contained in the chromosomes in the nucleus of every cell. But cells must coordinate their activity, and to do this, they must communicate. The nervous system provides communication via nerves, delivering messages in microseconds, and the endocrine system provides communication via hormones, which travel around the body in the bloodstream. Chemically speaking, hormones are either proteins, amino acid derivatives, or cholesterol derivatives, and they are secreted in response to nervous stimuli, such as sight, touch, hearing, taste, smell, thoughts, emotions, and so in response to various chemicals in the bloodstream, including other hormones. The pituitary gland at the base of the brain, for example, secretes a number of hormones designed to stimulate other hormone-producing glands into action. The hormones produced by these subservient glands circulate in the blood, but if their concentration in the blood falls below or rises above a certain level, the pituitary adjusts its output of trophic or stimulating hormones. However, the pituitary is not the prime mover of the endocrine system. This role is played by the hypothalamus. The hypothalamus is a distinct group of cells at the base of the forebrain, which extensively connects to the cortex, brainstem, and hindbrain. Stimulating and inhibitory hormones secreted by the hypothalamus in response to nervous impulses from other parts of the brain travel the short distance to the pituitary beneath it, and the pituitary responds by increasing or decreasing its secretory activities. The anterior lobe of the pituitary secretes growth hormone called prolactin in order to stimulate production of breast milk, and hormones that stimulate the thyroid and adrenal glands, and also the ovaries and testes. The posterior lobe of the pituitary produces antidiuretic hormone in order to decrease the excretion of water by the kidneys, and oxytocin to stimulate the milk flow and contraction of the womb after childbirth. The thyroid gland, which lies in the neck opposite the Adam's apple, produces thyroxine, which controls your metabolic rate, which is the pace of the chemical activities in every cell in the body. Iodine is an essential component of thyroxine. Directly behind the thyroid are the 4 parathyroid glands. These produce parathyroid hormone, which together with calcitonin produced by the thyroid control calcium metabolism. The 2 adrenal glands, one perched on top of each kidney, secrete the fight or flight hormones, adrenaline and noradrenaline, in response to stimulation of the sympathetic nervous system. The adrenal glands also secrete steroids, all of which are made from cholesterol. 2 of the most important steroids are aldosterone and cortisone. Aldosterone controls the balance of potassium, sodium in the blood, and cortisone plays a crucial part in carbohydrate, protein, and fat metabolism and many other processes. The adrenal glands also produce small amounts of androgens, which are masculinizing hormones in both women and men. However, the major androgen producing role in the male body occurs in the testes, which produce testosterone. In women, femaleness, fertility, and the menstrual cycle are controlled by estrogens and progesterones manufactured in the ovaries. The testes also produce small amounts of estrogens. Another very important endocrine gland is the pancreas, which lies under and behind the stomach. It produces 2 hormones that regulate the level of glucose in the blood, insulin and glucagon. Insulin encourages cells to absorb glucose, and glucagon encourages stores of glucose to be released into the bloodstream. Both hormones are produced in response to levels of glucose in the blood. If the cells that produce insulin become diseased or unresponsive, the result is diabetes. Many other parts of the body, such as the heart, kidneys, stomach, intestines, and placenta, also contain cells that produce hormones. Acromegaly. Acromegaly occurs in middle age and produces a general thickening and increase in the size of bones, structures, and organs. These changes include the enlargement of the hands and feet, head, neck, lower jaw, nose, ears, and also the thickening of the skin and tongue, tingling in the hands, sweating, stiffness, deepening of the voice, and an increase in body hair, especially in women. The cause of acromegaly is overproduction of growth hormone due to a pituitary tumor. Other consequences may be hypopituitarism and visual problems. If the tumor on the pituitary is large enough to press on adjacent strictures in the brain, diabetes, mellitus, high blood pressure, and heart failure can occur. The orthodox treatment for acromegaly consists of drugs to suppress the production of growth hormone and/or surgery to remove the tumor on the pituitary. Unfortunately, the physical changes that occur are more or less permanent. Specific remedies to be taken 3 times daily for up to 21 days once the pituitary tumor has been removed. Conchiolinum, that's Conchiolinum 6C, followed by Hecla 6X in the same dosage. Addison's disease. Addison's disease occurs when the cortex of the adrenal glands fail to produce enough steroid hormones, in particular hydrocortisone, which among many other things suppresses the inflammatory response. The symptoms of Addison's disease onsets insidiously, beginning with fatigue, indigestion, and loss of appetite. Later, the person loses weight, develops anemia, and has increasingly frequent bouts of nausea and vomiting, as well as diarrhea or constipation. The skin also darkens as if permanently tanned. Eventually, hypoglycemia may set in, or the adrenal glands may fail altogether, which quickly leads to a collapse, and the symptoms are similar to those of gastroenteritis. If this happens, see a doctor within 2 hours. If Addison's disease is suspected, see your doctor. If blood tests reveal abnormally low levels of steroid hormones, hydrocortisone will be prescribed. However, before taking hydrocortisone, which has to be taken for life, see if one of the homeopathic remedies that follow helps. Specific remedies to be taken 4 times daily for up to 7 days. If no improvement within 1 week, then see your doctor. Constipation, muddy complexion, dry lips and mouth, craving for salt, symptoms made worse by hot sun. Use Natrum 30C. Tremor, apprehension, craving for salt and sweet things. Use Argentum 30C. No stamina, feet sweat profusely and smell unpleasant. Cold weather makes symptoms worse. Use Silicea 30C. Aldosteronism is a consequence of overproduction of aldosterone by the cortex of the adrenal glands. The symptoms are high blood pressure, muscle spasms in the hands and feet, thirst as well as a large volume of urine production, and weakness or tingling in the limbs. The cause of increased aldosterone production may be cirrhosis of the liver, heart failure, or some other chronic ailment, or a benign tumor in one or the other of the adrenal glands. Orthodox treatment consists of diuretics and surgical removal of the tumor if necessary, as well as treatment of the underlying cause. Constitutional homeopathic treatment is recommended in addition to orthodox treatment. I have a great many videos now on many different topics, and so I've decided to make several different video playlists so that it's easier to find the videos of greatest interest. So please check out my playlist page. Well, that's it for now. To stay up to date with my latest videos, make sure to subscribe to this free YouTube channel by clicking the red subscribe button right below this video. Take care.